Have you heard of DiGeorge Syndrome or DiGeorge Syndrome? It's caused by a tiny missing piece on chromosome 22. We call it a 22q11.2 microdeletion. That small genetic change affects how certain cells migrate during development, leading to problems in the thymus, parathyroid glands, head, and even the face. What happens in the embryo? Here's a simple way to understand it. In early development, we have small structures called pharyngeal pouches. In DiGeorge syndrome, the third and fourth pouches don't develop properly. That's why the thymus and parathyroid glands become underdeveloped. We call that hypoplasia. Okay, you might say, what's the relationship between the third and fourth pouches to the thymus and parathyroid glands? So the third pouch gives rise to thymus and inferior parathyroid glands, whereas the fourth pouch gives rise to the superior parathyroid glands. Okay, let's start with the parathyroid. What does the parathyroid do? The parathyroid glands control calcium levels by releasing PTH, which is parathyroid hormone. In DiGeorge syndrome, these glands are underdeveloped, so the parathyroid hormone level drops. As a result, calcium falls and the baby develops hypocalcemia, which is low calcium in the blood. What are the signs of hypocalcemia? Low calcium makes nerves and muscles overly excitable. So babies can have tetany, muscle spasm, or even seizures. Two classic clues are Chvostek sign, it's facial twitching when you tap the cheek, and Trousseau sign, the hand curls when you inflate a blood pressure cuff. So again, we have two classic clues in hypocalcemia. The first one is Chvostek sign, which is facial twitching when you tap the cheek, and Trousseau sign, in which the hand curls when you inflate a blood pressure cuff. Okay, what happens to the thymus? So the thymus is where the T cells mature, the key fighters of the immune system. You know that. In DiGeorge syndrome, the thymus is underdeveloped, so T cell numbers drop. That means the child is more prone to recurrent viral and fungal infections. Now let's talk about another clue here, which is chest x-ray. So what's the chest x-ray clue? Normally a newborn's chest x-ray shows a faint shadow where the thymus sits. If that shadow is missing, it suggests thymic hypoplasia, a key feature of DiGeorge syndrome. Now here's a question. Why do these babies get infections? Simply because T cells are low. Therefore, these babies can't fight certain infections effectively. They are especially vulnerable to viral, fungal, and protozoal infections, all because their thymus didn't develop properly. Here's another question. Are there any heart defects in DiGeorge syndrome? The answer is yes, we may see heart defects in DiGeorge syndrome. We call them conotruncal anomalies. Things like truncus arteriosus or interrupted aortic arch. Alright, what about facial features you might see in DiGeorge syndrome? If the developmental problem extends to the face, you may notice a small jaw, which is called micronathia. Also, you may notice low-set ears, wide-spaced eyes. It's called also hypertelorism, and or a cleft palate. Okay, here's the core embryology in one line. DiGeorge syndrome is a failure of neural crest cell migration into the third and fourth pharyngeal pouches. That's why both the thymus and parathyroids end up underdeveloped, leading to T cell deficiency and hypocalcemia. And here we have a mnemonic to remember DiGeorge syndrome. The mnemonic is catch 22. So the first letter, which is C, is for cardiac defects, then A for abnormal faces, and T for thymic hypoplasia, C for cleft palate, and H for hypocalcemia. And all of that is due to the microdeletion of chromosome 22. Perfect. Let's wrap it up. DiGeorge syndrome 22q11.2 microdeletion causes low calcium from parathyroid hypoplasia, low T cells from thymic hypoplasia, and sometimes heart and facial defects. And that's DiGeorge syndrome explained in questions pattern. Thank you for listening. See you in the next episode.